On-the-scene video coverage of ESC 2012 is supported by Pradaxa.
Welcome to On the Scene Video ESC Highlights Final Edition. 4 trials reported as hotlines here delivered take-home messages that may influence clinical practice. TRILOGY-ACS, Shock IABP, FAME2, and WOOST. First, TRILOGY-ACS.
Most ACS trials are focused on revascularization, appropriately so. This trial focused on patients who were initially medically managed for their acute coronary syndrome, and indeed most of them continued to be medically managed throughout the trial duration. Patients were randomized to clopidogrel or prasugrel, and for the overall trial it was a negative result. No benefit of prasugrel over clopidogrel on the primary endpoint, though recurrent ischemic events were significantly lower with prasugrel versus clopidogrel in a pre-specified analysis. So some signals there, but the overall trial was negative.
I think we have to respect the results of the trial, meaning that in the face of what we have traditionally as clopidogrel, a more powerful agent has not panned out. At least strictly in overall primary endpoint of changing outcome overall, particularly in the first 12 months after institution of the therapy.
Shock IABP.
So this was the first randomized trial, patients with cardiogenic shock, randomized either to balloon pump or not balloon pump, 30-day mortality. And in fact, it was a negative trial. There was no significant difference in the patients who received pumps as opposed to those who didn't, Chris.
Well, it's a surprising finding. I think these are obviously the sickest coronary patients that exist, and often we have to put in balloon pumps to support them. This was trying to look at sort of prophylactic use on the way towards revascularization. And I think this points to the fact that the revascularization ends up being the key driver that's been seen in multiple studies of good outcome. And tiding along with a prophylactic balloon pump didn't seem to help. There'll still be some people that will need it because their blood pressure is, terrible and they just can't do the procedures. But to have that more of a routine, I think that'll back off a little bit.
Yeah, absolutely.